How to sleep with a scoliosis brace. The most common type of scoliosis is something called idiopathic scoliosis, means that there's no known cause. Approximately 80% of all diagnoses of scoliosis are considered idiopathic. The remaining 20% of scoliosis cases are associated with known causes. One type is called neuromuscular scoliosis, which is about 5% of all cases. Congenital scoliosis is another 5% of all cases. And then in adult scoliosis, we have something called adult onset scoliosis, which is degenerative scoliosis. But again, the majority of cases are adolescent idiopathic scoliosis that go diagnosed or undiagnosed. Now, when we look at scoliosis, we know the most common type is adolescent idiopathic scoliosis, which is typically diagnosed between 10 and 18 years of age. Also in this age group is typically the most common age group that's also braced. And therefore, since bracing tends to be one of the common treatment options for scoliosis cases in this age group. Now, scoliosis, unfortunately, is a progressive condition, so it's its nature to worsen over time. And it typically worsens from mild to moderate to severe to very severe. So every very severe scoliosis more than likely was mild at some point, and it progressed and worsened during very critical times. And in adolescent, it's typically during growth. Growth is what triggers progression. So therefore, adolescents with their rapid, unpredictable pubescent growth spurts are at the most risk for rapid phase progression. Now, progression can be very quick at this stage. I've seen curves progress 25 degrees in as little as 6 to 8 weeks. The largest curve I've seen in a child still growing has been 155 degrees. So curves can be very severe at this stage. And unfortunately, there's no way to determine which ones will worsen and which one won't. However, we also know that as the curve gets bigger, it's more likely to get bigger. So therefore, the treatment for idiopathic scoliosis typically focuses on slowing down progression and holding it despite the fact they're growing and possibly worsening or trying to counteract the worsening nature of the scoliosis. However, modern conservative treatment also has the ability of trying to reduce the scoliosis during this growth phase, so when they stop growing, they actually have a smaller curve. Now, this is a relatively new approach. Approaches typically in traditional approaches are just trying to slow it down. Now, scoliosis braces are braces that fit around the torso around with different methods and designs, applying pressure or trying to squeeze the spine in certain locations to try to slow down progression. Braces are known to be mostly effective on growing spines, hence their most prevalent use in adolescent idiopathic scoliosis. However, braces can be prescribed in adult cases, especially braces that are designed with a modern approach. Now, braces can be prescribed for different varieties of wear time. There is patients that only get prescribed with sleeping braces. They only wear it part-time. They only wear it to sleep. And braces can be worn full-time. That means they're worn up to 23 hours a day. And the dose they can wear this for can be anywhere from 18 months to 2 years, and sometimes up to 5 or 6 years, depending on how much growth and development the child still has. Now, one thing we have to understand, not all braces are created equal. Some have very different treatment designs and very treatment goals and different features and benefit when it comes to comfort and possible improvement of the scoliosis. So just because you have a brace doesn't mean you have a brace like somebody else's brace. There's very different designs when it comes to different bracing. And when we look at braces, I like to break them down into two specific categories. One is traditional scoliosis braces. And traditional scoliosis braces are typical braces that are prescribed by orthopedic surgeons. And by far the most common type of brace is something called a Boston brace. A Boston brace is typically a brace that was created in the 70s, and it's made of rigid plastic, and very little has changed since it was initially designed back then. And the goal of this brace was to make bracing more simpler to prescribe. Before the Boston brace, most braces were designed from plaster cast, meaning they would develop a plaster mold of the patient, then a sculptor would come in and sculpt the mold into an opposite position, and they would develop a brace in a more corrective manner. But that took a lot of time and a lot of effort, and therefore as a result of that, in the 70s, we started developing Boston braces, and the Boston braces were developed to try to squeeze the spine unnaturally, trying to force it into a straighter alignment. And this pressure actually weakened the spine, and it would cause a lot of comfort issues because the curve was actually worsening. And as the squeezing force was applied, patients would notice more and more pressure, and therefore it led to uncomfortable bracing and a lack of compliance. Also, since these braces were designed very low into the beyond the buttocks of the child, and this led to very uncomfortable laying down on their back because of where the brace was designed. These Boston braces unfortunately don't have great results, but it's all they have, and they're still using this same type of brace today. Another type of traditional brace is something called a Providence brace, and this is a nighttime brace where the person is actually being squeezed but also bent, and it's called a nighttime bending brace or a Providence brace or a Charleston brace, very similar, and they're just squeezing and bending. It's just applying the bending component, but since they're bending, they only can wear the brace while they're sleeping. This bending component makes it very difficult to sleep in the person's with the brace because they have to be laying in one position while they're bending. They can't lay on their sides. They're pretty much only laying on their back. And again, being constantly bent, it makes it very difficult to sleep. So sleeping in a modern scoliosis brace can have a very different effect. Modern corrective braces are designed like the braces were pre-Boston brace. They're designed with the person in mind. They're not designed like mass-produced in a specific form. The patient is actually scanned, and the brace is designed in a three-dimensional manner to help correct the scoliosis. So each brace is unique to that person, unlike the Boston brace. And these corrective braces are designed in a way to fit the patient to produce a reduction in the curvature and improve the shape of the person's torso. Once we change the shape of the person's torso, now we know the brace becomes more comfortable. It's kind of like braces on your teeth. When you wear braces on your teeth, if your teeth keep getting further and further alignment, the braces that you're wearing are to get more and more difficult to wear. But once your braces on your teeth change the shape of your teeth and your teeth actually become straighter, the braces on your teeth don't hurt anymore and don't cause no discomfort or no problems because there's improvement in the shape of your teeth. And that's the best way to get better sleeping in a brace, is to actually improve the shape of your scoliosis. The straighter your spine becomes, the more reduced your scoliosis becomes, the better the shape of your torso becomes, the easier the brace becomes to wear, and the better you're going to sleep in it. And so therefore, curve reduction is by far the best thing to do. But in addition, is having a brace that's fitted to you properly, that's functional, that's meant to be for you to move in and function in and breathe in and move and walk and sit and do all these things that make it easier to also wear a brace when you sleep properly, and a brace that allows to accommodate you in multiple positions, being on your back or on your side or on your stomach, for you to find the most comfortable way to sleep. Now, we do recommend trying to sleep on your back with a scoliosis brace. However, you can sleep in any position because the brace is designed for you with offering a very corrective potential. So we know all scoliosis braces do offer some restrictions, and they always make it a little bit more difficult initially to fall asleep. But once a scoliosis brace becomes corrective in nature and starts to reduce the scoliosis, we know scoliosis braces should become easier to sleep in. In fact, most of my patients, when we start weaning them from braces, they have a hard time taking the brace off while they're sleeping because they get so used to it, because they find it so comfortable and so reassuring that they know they're sleeping in the brace. In fact, many of my patients continue wearing their brace to sleep in. In fact, after we start weaning them, because they just like to do it and find there's no harm to do that because it's acting like a retainer would on your teeth, trying to hold the reduction that we achieved. Here at the Reduction Center, we treat many adolescent idiopathic scoliosis with these modern corrective braces because we know we produced very corrective results by helping push the spine into a straighter position with a corrective design brace. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.